system is for the normal rhythmic movement and steady posture. To assess coordination, observe the patient performing rapid altering movements, point to point movements, gait and other related body movements, standing in specified ways. The rapid altering movements coming to the arms show the patient how to stick one hand on the thigh, raise the hand, turn it over and then strike back to the hand down to the same place. Urge the patient to repeat these altering movements as rapidly as possible. Observe the speed, rhythm and smoothness of the movements. Repeat with the other hand. The non-dominant hand may perform as well. Show the patient how to tap the distal joint of the thumb with the tip of the index finger, again as rapidly as possible. Now the legs. Ask the patient to tap the ball of each foot in turn as quickly as possible on your hand or the floor. Ask the patient to touch your index finger and then his or her nose alternately several times. Move your fingers so that the patient has to change directions and extend the arm fully to reach your finger. Observe the accuracy and smoothness of movement and watch for any tremor. Now hold your finger in one place so that the patient can touch it with one arm and the finger outstretched. Ask the patient to raise the arm overhead and lower it again to touch your finger. After several repeats, ask the patient to close both eyes and try several more times. Ask the patient to place one heel on the opposite knee, then turn it down, then shin to the big toe. Observe the movement for the smoothness and accuracy. Next, the gait. Ask the patient to walk across the room or down the hall, then turn and come back. Observe the posture, balance, swinging of the arms and movements of the legs. Normally, balance is intact. The arms swing symmetrically at the sides and turns are smooth. Ask the patient to walk heel to toe in straight line, called the tandem walking. Ask the patient to walk on the toes, then on the heels. This tests plantar flexion and dorsiflexion of the ankles. Ask the patient to hop in place on each foot in turn. This tests proximal and the distal muscle strength in legs. And do a shallow knee bend first on one leg and then on the other. Steady the patient if you think the patient might fall. This is mainly the test of position sense. The patient should first stand with the feet together and eyes open and then close both eyes for 30 to 60 seconds without any support. Note the patient's ability to maintain an upright posture. Normally, any swagging is minimal. The patient should stand for 20 to 30 seconds with eyes closed and both arms held straight forward with palms up. Next, instruct the patient to keep the arms out and eyes shut and tap the arms briskly downward. The arms normally return smooth.